I'm happy to report that NMS has performed its task quite well across the 4 transferred functions in accordance with County Integrated Development Plan, resulting in tangible positive outcomes that many Nairobi citizens can attest to. Without further ado, I'll not elaborate the task that we have done. It is well covered in the report, but in the health sector, remember we were formed under COVID and we had a stretch to extend the health facilities, especially in informal settlement, and I'm happy to report that we finished the 20 hospitals. They are fully operational and running, both level 2 and 3 facilities across all the marginalized areas and informal settlements. We have also facilitated the construction of additional ICU facilities at Mama Lucy Hospital, extra wards dedicated specially for COVID. We have also completed Mama Margaret Kenyatta Hospital that has been stalled for over 3 decades. Additionally, NMS, with the support of national government and in collaboration with other state agencies, oversaw the sinking of 193 boreholes in informal settlement that has eased the problem of water, especially in the marginalized and informal settlement. NMS has also acquired 29 water bowsers that has increased the much needed supply of water, as well as acquiring 13 new ambulances, which will help the county government in its health functions. Under universal health care, NMS has identified 326,000 vulnerable people for NHIH support, and we have already sponsored 66,000 households within Nairobi, and I'm sure His Excellency the Governor will surpass that target as he takes over. Additionally, NMS has enhanced provision of health, finance and medical equipment, capacity building for human resource for health, and formulation of health policies and bills to improve service delivery. On transport and public work, NMS has covered almost 350 kilometers of roads, rehabilitated over 100 kilometers of road, maintained 88 kilometers, and developed 20 kilometers of non-motorable transport corridors that has enhanced efficient transport of people, goods, and services. NMS has already constructed 3 footbridges and 5 motorable bridges to enhance vehicular and pedestrian passage, and on top of that, we have already bought 20 more new bridges, which His Excellency the Governor will install in various places. To decongest the CBD, and in line with a recommendation contained in the Nairobi Integrated Urban Master Plan, NMS has commenced the construction of 6 bus terminals outside CBD. To date, NMS has completed the construction of Green Park, Park Road, Desai Road, Westland Bus Terminus. NMS has also rehabilitated Mudhurwa, Kangemi, Hakati Bus Terminal. The county government, I'm sure under Sakaja, will complete the other bus terminals and operationalize them to achieve the desired outcome. NMS has also overseen the commissioning of Kangundo Road asphalt plant that provides material for constructing, upgrading, and recarpeting of city roads at a much lower cost. In housing, NMS has surveyed 6,863 county allotted plots and have already processed 13,834 land lease documents.
Under National Titling Program, a total of 7,248 titles were processed and are currently being issued to Nairobi landowners. To bring services closer to the people, NMS partnered with the judiciary to construct 4 small courts in Nairobi. These include a court in Mihango, court in Kasarani, a court in Dagoretti South, and a court in Huruma. And the construction is underway and is about to be complete. I'm sure His Excellency the Governor will commission them very soon. NMS has also rehabilitated rental flats in Jamhuri, Buruburu, and Kariobangi South Estates. Further, we have upgraded 8 markets and trading centers, namely in Mudura, Wakulima, Landis Road, Toi Market, Embakasi Village, Kariobangi South, Kayole Spine, and Jericho. This has not only improved the status, but also enhanced the dignity of Nairobi residents. Plans are underway to rehabilitate all other county houses. To afford residents decent housing, we took over from the county Pangani and Jivanji housing projects, where Pangani alone delivered 1,562 housing units, and Jivanji will generate 1,830 units, with 8 more estates earmarked for development through public-private participation. NMS prioritized efficiency in processing development control application, resulting in clearance of a backlog of 5,400 development applications within the first 100 days, as well as developing an online platform to handle development control in Nairobi. Introduction of quick response code has eliminated the need of manual stamping and signing approval finally. This is in line with automated services and access under one platform, hence the establishment of Nairobi revenue system. Underwater and the environment. In order to restore the city's title of Green City under the sun, NMS employed robust environmental practices aimed at restoring the city's lost glory through sustainable waste management and proliferation of green infrastructure. NMS has increased the garbage collection to almost 3,000 from previous 1,800 tons per day, and boosted by reactivation of 35 ground solid waste collection trucks, which has greatly enhanced the city solid waste collection capacity. NMS, in collaboration with other government agencies, eliminated illegal dump sites and rehabilitated them, thereby enhancing greenery in the city. We have also NMS has also contracted 2 material recovery facilities in Mudhurwa Market and Molem, which are at 40 and 60% complete. These have been done using internal capacity. Plans are underway to commence construction of 6 more material recovery facilities within various sub-counties in Nairobi. The rehabilitation of Michuki Park, Uhuru Park, and Central Park, which had been left in a dilapidated state for years, has seen the upgrading of the public parks into world-class recreational facilities. The revitalization of Jivanji Garden is almost 60% complete, while the plant and flower nursery at City Park is almost 70% complete. NMS also undertook beautification and landscaping projects along development works, including newly constructed hospital compounds, bus terminal, and NMC corridors.